Hi, I'm Heather from Chiropractic.com, and I have some guests that are going to share some great information with you guys today. But first, I just wanted to share a little bit about myself. I founded Chiropractic.com, which is a website where I share information and recipes for healthy living and a chiropractic lifestyle. And a few years ago, when I became pregnant with my first child, I didn't really know anything about home birth, and I started looking into it. And after I did some research and looked into it further, I decided it was definitely the way to go. I wanted to have a natural birth without any medications, and I found that by doing a home birth with a midwife, that really supported my birthing plan. I have two kids, and I did a home birth with a midwife for both of them. I had a great experience, and I couldn't imagine doing it any other way. So now I'd like to introduce our guests for today. Our first guest is Jen Anderson-Tarver. She is a certified professional midwife and a registered midwife with a small home birth practice called New Leaf Midwifery. She serves the Denver metro area. She's a graduate of National Midwifery Institute, a MEAC accredited program, and through apprenticeship training. She's committed to a woman-centered midwifery practice that is informed by current research, mindful of traditions, and sensitive to intuition. She has a 3-year-old son who was born at home. And our second guest is Dr. Michael Dody. He is a licensed chiropractor serving the Littleton, Colorado community. Dr. Dody has done advanced training for pediatric chiropractic. He practices with a gentle but very effective adjusting technique called core-specific technique. So thank you guys both for being here today. Jen, let's start with you. Let's get started by, why don't you just tell people a little bit about how you got into midwifery, and for anybody who doesn't know, can you just give us a quick explanation of the difference between seeing a midwife and a regular OBGYN? I know some midwives work in hospitals and some don't, so maybe you could touch a little bit on that.
Sure. Thank you guys for inviting me to do this with you today. I originally got into midwifery actually through a friend who was training to be a doula, which is a woman's labor companion in pregnancy and birth. A doula doesn't do anything medical, but she had gotten introduced to being a doula, and then she was in the process of becoming a midwife. And she got me inspired to read books about fertility awareness, and just became aware of how powerful women's bodies were, and how important it was to naturally support them for optimal results in optimal living. And that kind of led organically for me to become a doula myself. So I practiced for 3 years, and I ended up working on staff as a doula at a public hospital in Minneapolis. And during that time, I had the opportunity to work with many different practitioners, anywhere from family practice doctors to OBs to nurse midwives in the hospital, and I worked with a home birth midwife. And as a result of that, I realized that I deeply desired an alternative model of care for being with women during pregnancy and birth, and a more expanded scope than what a doula could offer, and I started working with a home birth midwife. So the difference, I would say, between a midwife and an OB is just typically pretty drastic. Although, that said, I want to just say that within each provider type, there are providers that are incredible and who truly honor women-centered care and are not being heroic or hierarchical, but are really honoring the woman and her intuition and working alongside her and partnering with her. But really, typically, that looks like the care from a midwife. A midwife tends to spend more time with clients and appointments. They're thinking about the whole person, the physical, the emotional, the psychosocial, and it's individualized. So they're meeting the woman right where she needs to be met and tailoring her care and the information she needs to her. So if she's a super healthy eater, you might not talk about nutrition all the time with her. Or she might be inspired to make certain changes. All of us could improve, so she might want support in those areas. So midwife gets to tailor that to what each individual person needs and their background, their knowledge, their research that they've done. And midwives tend to honor normal. So birth is a normal process. People are giving birth all the time, uneventfully, without even, all across the world, without even care of midwives. or doctors or in hospitals. And, so women need to know that birth is normal, and the midwife is there to do that. So we're not there to, talk about everything to avoid, but rather what to do to support a healthy pregnancy.
That's great. It sounds like you have some great background, and it was a great transition into midwifery for you.
Yeah, it was a wonderful experience.
That's great. So what are some of the ways that you help keep pregnant women healthy, and what do you do or recommend for them?
Well, I think nutrition is really key. Chiropractic really emphasizes this, chiropractic care emphasizes this as well, that just moreover any supplement that you could take, having a diet that is whole food based, low in processed food, with moderate to high protein and full of vegetables is really what's ideal. The American diet that's full of processed food is not ideal. So moving away from that is key in pregnancy. I think a lot of people too often give in to their negative cravings during pregnancy, thinking that there's a social stigma that you need to just give the pregnant mother whatever she wants. 2 scoops of ice cream every day, great. But really, it's actually the opposite of that, that we should be eating as healthy as we possibly can. We should be at our utmost best through pregnancy and in nursing to support this growing baby, because we are shaping their taste buds. And, everything that we eat goes in and tints the flavor of the amniotic fluid, and they're getting exposed to that. And so later on in their lives, the kids that were exposed to all those healthy vegetables and wonderful foods then are the kids that eat those healthy vegetables and wonderful foods as toddlers.
Yeah, I couldn't agree more than that. That's very well put, and I think that what better thing could you do for your child than to provide a healthy lifestyle right off the bat? So that's great.
Yeah, exercise is also very key to me. Not high impact exercise, but moderate impact. So swimming, elliptical bike, stationary bike. Running if you were a runner, but in general, more low impact things, yoga, Pilates in pregnancy. Those are incredible, and stretching. And not trying to train for a marathon, but maintain just moderate exercise and keeping yourself flexible.
Yeah, that's a great point. I think that a lot of times people think about, when they get pregnant, I need to kind of cut back or reduce the exercise. I can only do so much and stuff. So I think, you made a good point that if you're used to doing these types of exercises, that you can continue to do exercise and stuff, then that it's healthy to do.
Yeah, they used to think that women shouldn't get their heart rate over 140, but if you're a healthy woman and this is the kind of exercise you've been doing, and you have no contraindication from your healthcare provider, there's no reason to be worrying about that or monitoring that.
Yeah, excellent.
And the other really important thing, I think, is just making sure that you're doing self-care. So to me, that looks like multiple different things, but some sort of meditation, relaxation, chiropractic, acupuncture, massage, prayer, however it is to, best take care of yourself, to align yourself and support your vitality.
Right. That's a great point. All right. Well, Dr. Dody, why don't you tell us a little bit about pregnancy and how it relates to chiropractic? What are some of the benefits and how could it help?
Definitely. Thanks for having me on, and I really am excited to do this because, like Jen said, I love the fact that we have a common idea of honoring that body's innate intelligence, whether it comes to birth or the healing process, things like that. So it is exciting to talk about this and talk about how the whole midwifery and chiropractic really works together in amazing ways, especially with pregnant women. But I'm going to start basically into the beginnings, and sometimes what we see are people who come in who can't get pregnant, and the big idea is that chiropractic care, just to kind of give you a background, is basically it helps we align the spine basically because that's where the nerve system is. And what we do is we help remove some of the stresses and what we call subluxations, which are interference in that mind-body connection via the spine that cause the body not to be self-healing and self-regulating and function all those things. What we talk about oftentimes is, for many women, infertility is rooted in the fact that the nerve system is not functioning and there's misalignment with that. And so since that nervous system is the master system that controls and coordinates everything, when it isn't functioning properly, the body doesn't function properly. In fact, they showed in research that, and we've seen this, in multiple different case studies, that people, like, let's say they come in and they're having issues conceiving, actually being adjusted can help the body prepare itself to be able to conceive and to carry a baby. The other thing that is big that we talk about a lot is basically because the nervous system, once again, is that master system. When you have a healthy one, it really makes a big difference on the future health of the baby as well and the mom. And pregnancy, let's face it, I mean, it's a major change for women. It's a big stress on the body. So if we can help, like Jen was saying about, being able to keep things aligned, to keep that self-care, to keep things functioning the way they should, and the baby can develop exactly the way the baby should, the mom can develop exactly the way the mom should as pregnancy goes on, and we can help with those things, it's huge. Because we all know that when you're changing as much as you do during a pregnancy, oftentimes things can happen. You can have symptoms like back pain, trouble sleeping, things like that, just because things are shifting and changing. And what we often find is when we are able to adjust the spine and keep that nervous system healthy, we see less of that, and the body is able to function a lot more normally. In fact, when we talk about some things like, with keeping things comfortable, what we notice at the clinic is we notice that people have, move easier, their hips move easier, they have less pain and symptoms that way. But we also notice a lot less nausea and morning sickness. The thing that keeps the baby and the mom connected is that nerve system. So making sure that things are developing properly, the baby's positioned properly, there's proper growth. And the cool thing about this is what we do is very, very safe, and it's very gentle, and it's an effective way to really be able to function, get things functioning, and allow that mom to be able to handle the stresses of pregnancy and all the changes that go along with it.
That's great. I like that. I think that, you have a great point that even though a woman may be having a great pregnancy and not having any symptoms or any pains or anything like that, she still needs to be connected through her nervous system because that's what's growing the baby. So I think that's a great point. Let's see, for both Jen and Dr. Dody, when do you guys recommend your patients start chiropractic care in their pregnancy? Let's start with you, Dr. Dody. What do you?
Well, and I think I always say, the sooner the better, because we're talking about the development and what controls and coordinates the development of the baby and the changing of the body, the woman's body, is that nervous system and that mind-body connection. And so if there's any issues that were pre-existing due to stresses that happened previous to conception, then we can help, remove some of those stresses, but also handling the stresses as they come along through the actual birth process. I love this quote by Sarah Clark, and I think that this is so true, that midwives have definitely understood this for a long time, and this speaks particularly to breech babies, that being able to turn them, and chiropractic is known to do that pretty successfully. But I think it's such a great connection, and that's why I love working with midwives in our practice, and people like Jen who understand that the body really knows how to do what it's supposed to do.
That's great. And what about you, Jen? For somebody, if you have a pregnant woman in your practice and stuff, when do you feel that they, need to start chiropractic care, or when would you recommend that to somebody who might need it?
Well, ideally they would start from the very beginning as well. And I think a lot of people treat chiropractic as something to just treat one ailment. So they have a breech baby, and then they go in, 2 times to get an adjustment to turn their breech baby, without realizing like all the benefits and the things that it could have curtailed from long before. They would have never gotten in that position. And I think, the benefits, like what you were saying, I've seen women who were doing chiropractic have less nausea, have less heartburn, have less difficulties with sleeping, have less issues with constipation, a lot of the typical kinds of things that you hear about what pregnancy brings. And so it seems that it'd be best to start that from the very beginning.
Great. This question is also for both Jen and Dr. Dody. What are some of the outcomes that you have seen in your offices with women getting chiropractic care? Jen, you already kind of touched a little bit on that. Did you have anything else to add?
I was just going to say that it seems like, in general, it seems like those women who've gotten chiropractic care have had faster, smoother labors with babies in more optimal positions. That's not always the exact case, but we're dealing with years and years of a woman's body maybe being out of alignment. So even 9 months doesn't change all of that history that we've carried around.
Right.
But I've had even just a recent experience this last month with somebody who had a very stalled labor and got adjusted twice in labor, and it made all the difference. Her hormones kicked in and picked up right after those adjustments, and then she was able to have a home birth.
Wow, that's amazing. I know I had the same experience, and I know I got adjusted through both of my pregnancies, and I know that it definitely made a difference with birthing. I had pretty quick and easy births for both of my kids, and they came out very healthy and very, just it was a great flow. So I know that made a huge difference. So Dr. Dody, what would you say to that?
I probably can't say it any better than you guys have, but let me just give you another quick story. We had a mom that came in for her second pregnancy. Her first labor was very, very long. It was a hard labor. It was over 24 hours of like pretty hard pushing, and it wasn't the greatest experience for her, needless to say, and I'm sure you guys could probably tell a bunch of stories about that, or heard stories about that. Well, she came in with her second child because she was told that chiropractic might help with that. And Jen, like you were talking about, we often see that when things are aligned, the baby is in a better position. The actual hard labor, or the pushing portion of that process tends to be a lot less when everything is lined up and ready to go. And she had such an amazing experience the second time with chiropractic, and it was just basically because that body was connected and it knew exactly what to do. And that with her third kid, she was in immediately, right when she found out she was pregnant, and had another great birth with her third child as well. So it's just fun to be able to help the body stay connected and do what it's supposed to do in such a miraculous thing like birth.
Yeah, and to reduce interventions too.
Absolutely.
Even interventions at home, to not have to go into weird positions, or not need any kind of repositioning from a midwife even. It's wonderful.
Yeah, that's a great point.
To not need any of that.
Yeah, that's a great point. I would say, anything you can do to reduce some of that stuff is a good thing. So, Jen, why don't you tell us a little bit about doing a home birth? What is it like? Why would someone want to choose a home birth over a hospital birth, or maybe even a birthing center?
Yeah. Well, I think the biggest thing is that home birth is flexible and adaptive to women, and being in your own environment, you're going to be naturally more comfortable, more relaxed. Your hormones are going to fire more naturally, and you feel less fear. So naturally, it seems that then things progress. And home birth midwives in general are less linear number driven. So there's allowing women to be themselves, and each individual labor to take its course, and knowing that each individual person gets to do labor in their own way, and going a little bit slower at first doesn't mean that you're not going to go faster later. We're not robotic like in a hospital setting. A lot of people will put clients on a Friedman's curve, needing to dilate a certain many centimeters per hour in order to be considered adequate, having adequate labor. And home birth midwives just don't think about that in that way at all. So I think the other thing is just freedom of movement, being able to eat whatever you want in your own house, not eating fast food or hospital food that is often really unhealthy, not being checked all the time for that progression. So basically less interventions. And, usually people, when they're left in their own rhythms, they find that rhythm, and then they can go into that labor land, because we don't birth from our mental brain, we birth from our animal brain. And so being able to really truly shut that down and be relaxed and primal, then obviously usually creates a better birth. I'd say also home birth just shines in terms of the after postpartum care, how much care a midwife is coming to their house, 1 day, 3 day, 7 day, and making sure that everything's healthy, that breastfeeding's going well. And home birth, what's normal is just delayed cord clamping and skin to skin, and letting babies self-attach and nurse. And so there's no fighting. You don't have to even be having this birth plan that you're advocating for in labor, because you know exactly who's going to be there. You've already talked it all through, and the midwife wants to honor what you want. So of course that leads to incredible breastfeeding rates of like 99% at 6 weeks. Whereas our national average is 30% of women are successful with breastfeeding. And something like 3 to 5% of a C-section rate instead of the national average of 33%. So the nice thing too is just that you don't have to leave at 4 hours, from birth center and go home. You don't have to have a nurse come into your room every couple hours right when you're about to fall asleep and talk to you about something or check in with you. But you can just be taught how to monitor your own baby and know the safety and parameters of what's normal. You don't have to be an expert. It's just really common things like taking temperature and looking at your baby and watching, knowing what's normal breathing, and we always teach all of that to our clients. And I just say, my final thing would just be to say that continuity makes a huge difference. So having the same care provider walk with you through pregnancy and birth, then in the postpartum period, there's so much trust that's built. So often in birth centers, there's quite a few providers, and while they might provide midwifery standard care, which is wonderful, and they're an excellent opportunity and option for people, but you don't have that continuity often. And so the gift of continuity is that they really understand the woman, and they can spot things like postpartum depression, or maybe curb postpartum depression through just giving them a person who's supportive and a deep outlet for talking through issues. So I see less rates of postpartum depression as a result of having home births.
I think those are all great points, and I remember all of those being such strong calling to me to do a home birth, and why I found home birth to be such an advantage over any other kind of birth. And I think it's like you said, that women, each person is an individual, and our bodies do know how to birth, so it doesn't look the same for everybody, but that specific person's body does know what to do. So I think that's great that midwives honor that. So is home birth safe for everyone?
No. Home birth is meant for healthy women. So that's low-risk women that don't have chronic health issues. There's, some few things that can not pose, increased risk to your pregnancy, such as very well-controlled hypothyroid, and that can be handled, within a home birth setting. But in general, pre-existing conditions like high blood pressure or blood clotting disorders or diabetes or seizure history when you're on medication, that should all not be done at home. You're better suited to be in the hospital and be monitored more intensely. There's a great link on my website, newleafmidwifery.com, to a couple of studies that just compare low-risk, healthy women births in hospital and home birth settings, and just talk through different risk factors of what would make one person a candidate versus another person not a candidate.
Okay, great. I'll have to check out some of
You can
those.
look. Yeah, there's a couple of studies, one in Canada that was done, and the Netherlands had a huge comparison study, and there's one with CPMs, both in 2009 and 2014, and they showed that women who are low risk have the same kind of outcomes, but with less intervention and less cesareans, but no increased risk in maternal or neonatal deaths or morbidity, severe outcomes. And they, obviously are just much more satisfied.
Yeah, I agree. And I had to ask that question because I know a lot of people, when they first hear about home birth, they feel like, oh, wow, like, I know I was told, wow, you're brave to be having a home birth. And I thought, to me, that was not brave at all. It would be brave to go to the hospital where I would have to be fighting for my birth plan to be followed, rather than working with a midwife who I knew I could trust, who knew what I wanted, even if things didn't go exactly according to my birth plan, who knew what the next step for me would be.
And it's so important to know that midwives know when to use those, or to suggest, or to get increased level of care, and so intervention is used at their proper place.
Right.
Not that you don't ever need C-sections or epidurals or Pitocin, but it's not very often.
Right.
And so just knowing when to use those, I think people then it doesn't feel as dehumanizing and traumatic to have a cesarean when you know that you've tried every single thing and it really is the time to have that.
Right. That's a great point. So what kind of things do you do in your practice, Jen, to have the pregnant women prepare for having a home birth?
Well, different women prepare different ways, and I encourage that. Some people take classes. They want to meet other home birthers. They might want to just meet other women who are into natural birth, and I really support that. Other people, they just want to talk over things during prenatals, and we have an hour to go over quite a bit of stuff each prenatal. So, we'll just touch on different areas to make sure that they're exposed to those kinds of areas and that they've had a chance to think through it and prepare. We always talk about breastfeeding and strategies for best latching and optimal, things that you can do to support your supply. And then they, of course, we're always checking in about exercise and self-care and, common complaints that come up, such as, I'm no longer sleeping and I wake up in the night with, my back really hurting. We talk through all sorts of different things. Well, have you tried these kinds of stretches? You might want to try yoga. Maybe you should go ahead and get an adjustment. So we're always supporting them in ways that they can take care of themselves. Great.
That sounds like a very all-inclusive plan that they get to go through. So now let's do, for both Jen and Dr. Dody, this will be, what are some of the things that parents can do to help their newborn baby stay healthy? Let's start with you, Dr. Dody. What do you think?
Well, this is the best part for me. I love, seeing newborns. And in fact, we just had our youngest practice member was a newborn about 3 months ago, so he's getting older now. But it's amazing to be able to get them adjusted right away. So that's one thing, obviously, that I do as a chiropractor. But I think the big things that really make a difference, and I know Jen can probably go into this a little bit too, is breastfeeding. She talked about those statistics with breastfeeding and how important breastfeeding is for babies. There's some controversial things like, chemical stresses through vaccines. That's a whole, probably another webinar that we could probably do and go into pretty far in depth. But keeping some of those stresses that, down to a minimum. The one thing that, we notice as far as is that, healthy baby is actually what the mom's eating. And because, if you are breastfeeding, what the mom is eating makes a huge difference in what the baby is getting. And that can, also lead to things if there's some allergies or issues with, colic, some other things as far as sleeping and stuff that really make it hard for the mom, especially in the first few months if the baby isn't sleeping or is really irritable or colicky. Now, the other thing we've noticed with colicky in the clinic is we've seen big time results with that, because the one thing that we notice, and I know, Jen, you can definitely speak to this, is that the birthing process, whether it's done in a hospital or at home, is not necessarily a gentle thing that happens. I mean, the baby coming out of the birth canal can definitely be a pretty, traumatic thing, stress physically. And what I often find is that the upper cervical vertebra, that C1, sometimes becomes misaligned in that process. And oftentimes, if that's misaligned, what we see with the baby is there's a lot of colic, there's a lot of irritability, stomach issues, the gassiness, things like that. And obviously, along with that, the trouble sleeping. And so when I've had babies coming in, where the parents are, obviously exhausted because they're, not getting any sleep at night due to the colicky baby, checking out that C1 or checking out the alignment of that upper cervical spine really makes a huge difference. And we often see results within a few visits, which is awesome. I mean, that's not always the norm, but it's oftentimes what we see. So those are a few things that I think that help. And then down the road, what we want to do is continue to make sure that, they're doing things to keep the immune system up, keep away from those ear infections, things like that often plague, toddlers that, as they grow up. And there's many ways that you can help promote naturally immune system function and other things like that. So those are just a few suggestions that I have.
That's great. I like those. How about you, Jen? Do you have anything to add to that?
Well, you touched on so much of it. I agree. I think breastfeeding is key. And of course, doing things that are going to be calming and attachment building for your baby. So wearing your baby, avoiding overstimulation for them. A lot of people just cart them around to every store and just really overstimulate these babies, but they haven't been exposed to all that, and the whole world is new for them. So, just slowing down for them, slowing down their lifestyles for them. And I was just going to say that I've seen huge differences come from chiropractic adjustments for newborns. Babies with torticollis, where they've got one side of their neck is really tight and it's causing them to not be able to nurse on one side, but they're having a great latch on the other, or they have a really shallow, inefficient latch on one side, but a great latch. That's like resolved with chiropractic. Or babies that are really fussy and it seems to quiet down their nervous system. Even tongue ties, after they get it clipped, they're still just not functioning in the same way. They're not used to stretching out their tongue, they're not used to using their jaw that way, and it just seems like doing a chiropractic adjustment even tends to help them get recoordinated.
Wow, that's great. It sounds like there's a lot of things that parents can do to, need to be aware of for their healthy newborn there.
I had one baby too recently that just hadn't been pooping very well. Wasn't constipated, but just was not doing well at 4 weeks and just wasn't pooping but every couple days. And they got a chiropractic adjustment and then started regularly pooping.
That's fun. It's funny you mention that, Jen. We have what's called the poop adjustment. that happens a lot more often than you think. But for some reason, because it's just like anything. I mean, that digestive system is developing, and as it's developing, sometimes it doesn't, it's not as regular as it should be. So we have the poop adjustment for those little ones.
Well, this has been great. Jen, is there any way that people can get a hold of you if they're interested in doing a home birth or if they have any questions for you?
Yeah, on my website is all my contact info and up on the screen here. Yeah.
Great. Thank you so much. And how about you,
Thank
Dr.
you.
Dody? Do you have a way people can get a hold of you if they have questions or if they're interested in chiropractic care?
Yeah, obviously, a lot of information about what I do is on the website. In fact, under the techniques, there's a video of me adjusting a 6-month-old, so you can kind of see how gentle the style that I do. It's much a different style of chiropractic for those little ones, and actually even for the adults, because we do the same for everybody. But yeah, just the contact information at dotychiro.com. The number's up on the screen there, 303-794-1737. If you have any questions, don't hesitate to give me a call.
Well, great. Thank you both so much for your time. We've learned so much. Is there anything else that either of you would like to add? Any last tips or closing thoughts that you would like to leave us with?
No, thank you so much.
Thanks, Jen. Thanks, Dr. Dody.
Thank you very much. I appreciate it.